This motion tonight highlights the terrible situation our health system is currently in and puts forward real solutions that can assist in turning this around. So, Minister, a recent survey carried out by the IMO found that 65% of nursing graduates are currently considering emigrating due to the cost of living. This government has failed to tackle the cost of living and housing crisis, and this is forcing healthcare workers to emigrate and is preventing many others from coming home. In relation to the Children's Disability Network teams, there was a census carried out by the HSE just over a year ago and found that 30% of staff places are vacant. That hasn't been addressed in a year. And the CNDTs are simply not capable with this level of understaffing of carrying out their role in the delivery of assessment of need and following on therapies for disabled children. Also, we know there are insufficient GPs and constituents were telling me that they can't get appointments in the local primary care centre. They're ringing and ringing and ringing and no one answering. And eventually, if they get an appointment and get blood tests done, they have to then ring back in to get those results. And then they refer them to the doctor if there's an issue of concern. That to me makes no sense. And some people are actually giving up because they can't get through and possibly serious issues are being ignored and not being addressed. So I think you failed to put a workforce plan in place to deal with the issue of recruitment and retention in the health service, and it has to be addressed. It's also the case that where you live determines what treatment you receive. I mean, a child in my constituency, I've raised this with you before, Minister, she was informed she couldn't receive an insulin pump because she was being treated in Cavan General. She could if she transferred her treatment to Drogheda or to Temple Street. I think this motion also highlights the complete failure of the Minister for Housing to tackle the housing crisis that has forced so many healthcare professionals to emigrate and prevent them from returning. So I think the government has to commit to urgently review its current housing plan and increase its targets for social and affordable housing for renting and buying, and also reduce rents and ban rent increases for a number of years. I think it demonstrates a total failure by the Minister for further and higher education to ensure there are adequate numbers coming through and training and course places for healthcare professionals. In reply to a recent parliamentary question I submitted, I was informed that for this academic year, only additional 17 places were created in physiotherapy and none in occupational therapy or speech and language therapy. So, I mean, the government must ensure there are adequate numbers of training and course places for healthcare professionals to fill the major gaps in our health service workforce. And it must urgently identify, examine and consider all potential mechanisms to address the cost of living barriers to recruitment and retention of key workers and offer a job guarantee to healthcare graduates. So I urge support for this motion. Good luck.